start? And I guess we can start. I'm sweating already. Like, insurance is definitely not the thing I'm very comfortable with. Ivan, you will need to control me more.
No worries about that.
Yeah, but I guess we can start with the thing that insurance was and is the first thing that you actually do when you move to Switzerland. That's the first headache you get. And first, you kind of choose whatever everybody are kind of suggesting, or you're taking whatever your family member or friend of the friend of the friend of the friend is suggesting to you. So it's like no brainer, just whatever it's, helping to you, and you just go forward. And as we get so many questions about how to choose insurance policy, or which company is the best, or what actually it means in Switzerland when you move, we decided to do questions and answers kind of session. And that's one of our first sessions on living in the Lilly Center, directly to the really uncomfortable questions when you move to Switzerland or you live in the first years. So I would just say thank you so much, Ivan, for having us and doing this kind of evening questionnaire. And I would just love to hear a little bit more about you and how you actually, work with us and your background and what the heck the insurance thing actually is.
Thank you, Lina, for the introduction, and welcome everyone to this information session. I hope you can profit from the information you get today. You asked me about me. Well, I'm Ivan, 45 years old, and I started in insurance business in 1969. No, in 1996, of course. I'm not that old, even though I look like. So in the last 25 years, a lot of things have changed. And it's not easy to keep up with all the information that changes every time. So I try to do that, and I'm really happy that I'm on a level, I could say, you could ask me almost every question and I will be able to answer them. So that's about me.
Quickly, fast, and without pain. So we definitely can dive into questions. I will just quickly put that in front of me, not to have too much awkwardness. One of the first questions we actually got was about the newbies. So if someone is new to Switzerland, the load of the bureaucracy may be confusing and overwhelming, right? Many people take out insurances they actually don't need, which is actually also truth. And main question is, which insurances are mandatory? And from your point of view, which additional insurances make actual sense?
All right. So everybody who takes residency in Switzerland is asked to take out an insurance within 90 days. So now the question is, where do you go? Who do you ask to? There are many insurance companies in Switzerland who could offer you health insurance. Most important is there is a mandatory basic insurance everybody needs. On top of that, it's your free choice if you want to have an upgrade, if you want to have add-ons, or cover the gaps which unfortunately occur in the basic insurance. So there is another mandatory insurance, which is the accident risk. So if you come to Switzerland and you don't have a job, you have, as soon as you get registered, you already have a health insurance, even though you didn't even pay for that. But because it's mandatory, some insurance company would cover for you. And not only for illness, but also for accident. As soon as you start to work, your employer would provide the accident insurance for you. And to make sure that you have accident risk covered, you could actually check your payroll. If there is a deduction saying NBU, which means nicht Berufsunfall, so non-working accident, you have accident risk covered, and then you don't need it anymore in your health insurance. So that's something people don't usually know. So they pay 20 or 30 francs a month for nothing because they can't use this accident insurance with health insurance. All right. There are other mandatory insurances, mostly your employer would have to cover them, like the pension fund, or they usually also provide daily allowance insurance, but this is not mandatory. So you really need to check your payroll, what is covered and what is not covered, because sometimes if it's a money issue, employees don't provide all insurances that are good for you. So in these cases, ask your insurance consultant, go to an insurance company, ask me if you like, and then I can help you, or they can help you to check whether you have the right insurances or not. So there are other insurances connected to different possessions, I say. So if you would drive a car in Switzerland and it's registered here, of course, you need third-party insurance. So if you bump into another car, your insurance has to cover that. So you need to take insurance out for it. Actually, you couldn't even get your car registered without providing an insurance cover. But if you have a car from abroad, you also have to go through all the processes, and in the end, they ask you for insurance. What's more, and that's not mandatory, and that's really funny because I believe it's one of the most important insurances here in Switzerland. That's your private liability insurance. If you rent an apartment and your landlord asks you to provide an insurance, so they would ask for private liability. This insurance covers you if you accidentally damage someone else's property, like the apartment. You know, you could scratch the walls, your pet could, I don't know, wet the carpet, or you could leave the water running in your tub and the water destroys the floor, the walls and other things. So this is actually very important. It could be very, very expensive if you don't have a liability insurance. There were also examples of people skiing in the mountains, bumping into another person. The other person got disabled, couldn't go back to work. So the person who caused the accident had to pay, or still has to pay, for the other person's loss, like salary, like medical costs, like torn clothes, broken glasses, and all these kinds of things. So as I say, private liability insurance is very, very important. Of course, you could add a lot, and I really say a lot of insurances depending on your needs. For health insurance, you could cover a hospital risk. You could have private insurance. For cars, you could have your own car covered if it's new, or many, 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 many other things. I don't want to give too much information because I don't want to confuse you. But in a personal conversation, of course, I could point out things that are important and would make sense as well. I hope I answered your question, Lena.
Yeah, to be honest, it's definitely, especially with the one that you actually need to also insurance your apartment and whatever is happening around, or your pets do. That's not the first thing you think when you move to Switzerland.
Not really.
Yes, and that's what we also kind of have as questions at the community center, that in the family, especially not the marriage family, but the partners, there are different insurances at the same time. Yes. And they are, like you pay there, you pay that insurance, you pay that insurance. At the end of the day, it's such a mix of insurances, and you actually don't know what you actually paying. So I definitely get that it's so important eventually, maybe after a year, when you actually do the insurance and you learn a little bit more about the system, to sit down and think, okay, so what exactly I am giving away and what I'm getting with everything what I'm paying.
Yes.
So definitely. Another question, and it's quite actually important. It's about the families with very low budget. How are they able to pay the mandatory health insurance and where they can get the help? And that's one of also questions that we, pop up very often at the center.
Yes, I can imagine that. And I think money is very important when you talk about insurances. As I said, there are mandatory insurances. You have to have them, but the government helps if you are really in need. Before you actually get social help, you could apply for financial support. So this is called Prämienverbilligung, which means premium, that's the word for the invoice you get every month. And Verbilligung means to make things cheaper. So depending on your taxes, there could be a part paid by the government.
Okay.
So to do that, you can actually apply online. They will connect with the tax department, and then they will calculate if you're eligible to receive this support. I
Well,
can also help with that.
yeah, if it's possible for you to share a link where actually directly to go there, that would be definitely very helpful. Kind of just to, that's a step first.
I could provide a link. The thing is that there are different or differences in every canton. So usually it's the Ausgleichskasse who would take care of these calculations and sending you the information if you are eligible or not. If you live in Lucerne, it's very easy. I could send you the link. For the other cantons, I would have to look them up. So I would actually rather ask you to send me your question or your need, and I will find out and send you the link afterwards. That makes
Perfect.
more sense, I believe.
Yeah, perfect. We actually have a first question. Sanya, thank you so much. Do all insurances provide the same level of coverage for basic and supplementary insurance?
Sonny, that's a very, very, very good question. So the basic mandatory insurance is the same in all of Switzerland and from all insurance companies, because the benefits are defined by law. So there is a council deciding whether a gynecologist is included, whether there is psychology included, or just a normal visit to your doctor. And there is actually a big list of what is covered by the basic insurance and what is not to be covered by the basic insurance.
Oh, that's so true. I was so confused when you pay the insurance and suddenly you realize you're going to the gynecologist and you get the bill, and I was like, hold on, I kind of
That's
paid
true.
for that. And then you read and it's like, oh, okay, not
It's not
actually
covered, or not every time. Maybe only once every
yes.
3 years you can get the money from your basic insurance. But then let's come to the second part of Sanya's question. She asks if also supplementary insurances are the same everywhere, but there is actually a big, big difference. I mean, you can have such an insurance, but you can also have such an insurance. And depending on your budget and on your need, of course, you can have everything covered you really need. There are certain things you will never be able to cover though, especially if it comes to food supplementals. So if you need special vitamins and you go to your pharmacy to get these multivitamin tablets, no insurance company would pay for that. If you have a prescription from your doctor and you have a vitamin compound which is on the list for prescribed medicine, then there is another exception. You could get a refund for those tablets. But as I say, check with your insurance company before you buy things which are expensive. Always ask them, send them information, maybe a price list of what has to be done. Because if the insurance company tells you they will cover what you ask for, they have to. And always ask for a written confirmation. Don't call them asking for covering any special things, because on the phone you will never be able to prove that someone told you that the insurance covers that expenses. All right, so Sanya asked a second question.
Yeah.
Do you find beneficial to collect offers from different insurances every year? Well, it would make sense to compare the different prices, because every insurance company has to calculate their premiums, so the prices, the monthly prices every year, and they collect the data from the previous year. So for 2022, insurance companies have to collect the medical costs from 2020. So they will calculate how much was the expenses, and they will break it down to one person, and so the tariffs are calculated. It's a complicated thing. You don't need to know the details. Most important is that there are differences every year. And actually, our government has asked all insurances to refund the reserves they accumulated in the year 2020. That's why a lot of people here in Switzerland get a refund. And usually it's a monthly refund, like 10 francs a month, or some insurance company pay the whole year at once. So you get 500 francs for the whole family at once. So there are differences in how they're refunded. But I believe that it's a good thing that these reserves are used to kind of lower the increase of payments every year. All right, there's another question from Sanya.
I know.
Would you like to read it, Lina?
Yes, I can do that. Do you see big difference in prices from one to another insurance? Would you be able to share top 3 insurer?
All right, so it depends on where you live. There are about more than 40 different regions in Switzerland. So even Canton Lucerne has 3 different regions. So if you live in the city, it's more expensive. If you live in the rural area, it's less expensive. So Sanya says she lives in Kriens. It is part of the urban area, so it's more expensive as if you would live in Entlebuch, which is in the rural area. So depending on the region, then also depending on your model you took out. So there is free doctor's choice. That's most expensive insurance model. There is a family doctor model. It's a little bit less expensive. There is a telephone model and other models as well. So it also depends on which model you're actually in or which one you would like to have. And then, and also very important factor of how your premium is calculated is the deductible. As you probably know, there are 6 different deductibles you could choose from. So I hope you can actually see when I write on the flip chart. So you can have 300, 500, 1,000, 1,500, 2,000, and 2,500. So if you are with a health insurance and you don't want to switch to another one, you can actually check your yearly expenses you have for your medicine, for your treatments. And if they are around 1,900 francs, if it's less than that, you could go for the lowest deductible. If it's more, no, opposite. If it's 1900 plus, then you should go for the lowest. If you almost have no expenses, if it's 1900 and less than that, you could actually go for 2,500 francs. And the difference in price is usually about 120 francs per month. I hope you can see it. It is visible. Very good. Except of the 2,500 down there. But yes, these are the 6 different deductibles. So of course, I could give you a list of insurance companies who would be the cheapest in every situation, but that would be a long, long list because, as I said, all these different factors have an influence on how expensive your monthly premium would end up to be. And also, if you need or if you want to have supplemental insurances, then of course the prices are also different. There are also supplemental insurances for that much money or for that much money. It's up to you.
Cool. Well, thank you so much for the answer. I will just dive into another question. So basically, this questions and answers session is kind of concentrating on health insurance since the new premiums for 2022 just have been published. What are the big changes in 2022 and what actually does it mean, the changes?
All right. I actually already covered that question with this reserves that have to be or are asked to be refunded to everyone in Switzerland. But there are also other changes next year. For example, psychotherapy will be included in the basic insurance. So nowadays, if you need psychotherapy, you could go to a psychiatrist and have a delegated psychotherapy, which makes things a little bit more complicated.
Okay. All right. So I guess that the question, for example, about being a foreigner and traveling to your country for some kind of health stuff and how the insurance covers, that would be for a later session, not for this one.
Yes, you're right. You also mentioned, Lena, that we want to cover health insurance now. I mean, there would be a lot of other topics like household insurance, life insurance, car insurance, and things like that. So I actually believe because now it's the time for health insurance, you have time until the end of November. So it's November 30th. That's the deadline to switch to another insurance company, or if you want to stay with your company, but you want to change the model or change the deductible, then it's also the same deadline. So you need to take contact with your insurance company. It's best to actually send them an email or a letter so they have something written that you want to change your deductible or your insurance model, or contact your consultant for an appointment. They will take care of you, give you advice, and then in the end, they will help you to switch to a different insurance model. All right. So as I said, I would cover only health insurance today. So if you have other questions, don't hesitate to write me an email. Lena will pop up my email address somewhere somehow, so you could send me your questions and I will answer them if you don't get an answer today, or if you want to have something answered regarding a different insurance.
During this period of time, you definitely are overwhelmed with the calls and cold calls just for sales. So to have either community or people you can trust and actually just sit down and just go through everything and decide without pressure, that's what is most important, I think, from my side, at least.
You're right, Lena. And just imagine these cold calls, they're actually not allowed anymore because there is a gentleman agreement within insurance companies that they are not allowed to do cold calls anymore. And actually, it will be written in the law quite soon. But the government is a little bit behind this agreement we have done within insurance companies already. So if someone calls you who you don't know and they want to know things about your health insurance or want to set an appointment with you, you need to ask them which company they are from and why they are calling. You don't know them.
I see we have the last question, I think, how to find right contacts to ask for offer and not to be cheated.
Yeah, as I said, it's probably the best thing to go to a insurance company directly, to an agency. You know, there are people working. You can see them work, and there is the logo and everything. So I believe if you ask for help them, or if you ask for help there, a person who is employed with this company will take care of you. And there is actually the official website of the government. So it's from Bundesamt für Gesundheit, which is the health department of government. This website is called Prim Info.
Well, basically, if you have nothing to add or you would love to add, feel free. If not, feel free, everyone, just to write the actual questions directly to Ivan. We will share with the video questions that you can directly to send. And I hope everyone kind of, force the freedom of the insurance till the November end.
There's actually one thing I would like to add. I mean, we all pay a high price for our insurances every month. Well, health insurance, of course. A lot of people ask me, why do I still have to contribute to the invoices I get from my doctor I go to? So to make things easy, if there wouldn't be any contribution, or we call it shared costs, your monthly premium would probably double as high as they are now. Because this deductible, retention fee, hospital fee helps to keep the prices on bay or at bay.
Yeah.
So a lot of people actually think about the costs before they go to a doctor. Of course, not when it's an emergency. Please don't think about money if you have an emergency. Go to the hospital, go to your doctor, get help as soon as possible. But if you have something, you have some pain in your stomach, think about, do you really need to go to a doctor? Or could you call a medical hotline maybe to explain or to ask for some more information and give you advice afterwards? So you could actually save the doctor's invoice, and you could directly go to a specialist. And if you call a medical hotline, you don't pay them, because usually these hotlines are for free. It depends, of course, on your insurance model, but most of insurance companies provide a telephone model. If you don't know a doctor, you're new to Switzerland, then it would be best to probably go for the telephone model. So you could call someone, they could refer you on to a doctor, you go to see the doctor, and if you like the doctor, fine, you could stay with this doctor for how long you want. The model. The insurance companies provide a list you could choose from, but they will never recommend a doctor because they're not allowed to. So it's, in the end, it's your choice which doctor you want to see. And also, if you have the telephone model, most telephone models are not as restrictive. I want to say They don't tell you which doctor you have to go to, but you decide which doctor you want to see. It could be a specialist, or it could also be that they tell you better go to a pharmacy, get your medicine, and they will actually pass the prescription on to the pharmacy you would like to go to. So this is actually a very good insurance model. But not everybody likes that, because there are people going to the same doctors for years and years and years. And of course, they will never want to change. They want to go to this same doctor all the time. So they are best off with a family doctor model.
Okay, that's the first time I heard that. I learned so much.
That's good.
Like, oh
I like
man,
that.
I need to find the list. Well, if anyone has any questions, feel free to write. And if no one has, basically, I don't have any questions in my list. So it would be kind of done. Maybe Yvonne, you have the last moments, not before the death, but before ending the call.
All right. Well, I think we covered a lot of things in this session. Of course, it's just like so much of the whole insurance cake, I say. But as I said, if you have questions, if there is something you need to know, if you have policy you would like to have checked, come to the Lilly Center Wednesday mornings. I'm usually there from 9:30 to 12 o'clock. I take my time to look at your policies. I would charge a little bit something for that check, but it's only 10 francs for members and 20 francs for non-members of the Lilly Center, just to make things not for free. So I give you some value. And as I said, if you would ask for more information, or if you need a quote for, a new car or something like that, I wouldn't be able to be independent anymore. But I would tell you, of course, how things would go on from there. All right. Okay.
Well, thank you, Yvonne. Thank you, viewers, and the viewers that will watch later on. It doesn't matter if it's a day or night. And I'm looking forward for the cherry on the top, maybe next time on our cake of the insurance. Yes. So thank you, everyone. And I wish an amazing and calm, safe, and healthy evening. So
thank you too, Lina. Bye, everyone.
Bye-bye, everyone.
Bye.
Thank you very much. Bye.